Hi, I'm Dr. Eric Brooker, and I want to welcome you to this presentation on Punctal plugs and dry eye management brought to you on behalf of Lacrivera. Today, we're going to be doing a comprehensive look at the evolution of how to use plugs in your office to be successful in treating dry eye disease and also maximizing your reimbursements during that time in order to have a successful dry eye clinic. Now, when we're looking at dry eyes, one of the things that we've discovered over time is that inflammation is one of the worst things that can affect chronic dry eyes. When you have inflammation in the eye, it can start to cause chronic tissue damage in the eye. So the first thing you want to do is eliminate the inflammation. If patients have also concomitant blepharitis, or allergies or other things that are causing inflammation in their eye, you need to take care of that first, because nothing that you do to treat the dry eyes is ever going to take care of that. So you need to eliminate that first. So that's the first thing we do in our office. In our office in Las Vegas, the Advanced Vision Institute, we like to really treat each patient individually, but the first thing we do in assessing our patients for dry eyes is we make sure they don't have any of those conditions like blepharitis or allergies, and if they do, we treat those first. And when you do that, you're going to start pushing patients toward being able to stabilize their tear film. And as you stabilize their tear film and you get their tear film back to a normal process, then you want to increase their tear volume. So many patients are afflicted with two kinds of dry eyes. Some have an evaporative dry eye, as well as an inflammatory dry eye with also a low tear volume or an aqueous deficiency. So in our practice, what we try to do first is to improve the tear film quality and then increase the overall tear volume. And that's going to give you the best results in treating your dry eye patients. The great thing about that is companies like Lacrivera have continued to evolve their products to patients. And with these new products, you can use them in order to treat your patients appropriately and get the best results. So we're going to examine some of these scenarios here today. So the first scenario I'd like to look at is your patient that comes in with a mild allergic conjunctivitis, as well as a concomitant dry eye condition. This patient has conjunctivitis. And what does conjunctivitis mean? Well, it ends in itis, so it's going to be just like anything else that ends in itis, which means inflammation of the conjunctiva. So you have a patient that is experiencing this. The first thing we need to do is bring the inflammation down in the eye. So you can use various dry eye treatments to do this, or various therapeutic medications. Usually in our office, we're going to use a mild steroid or an immunomodulator. And we also may look at a mast cell stabilizer with an antihistamine in some cases, depending on the signs the patient is showing. As you bring that inflammation down and the tear film starts to improve, a lot of times that dry eye condition that's now present because this patient had an inflammatory event and that tear film now needs to recover, this is the point where we need to step in and consider increasing their tear volume. So a good way to test this, especially in patients that have a fair amount of tears still there, is to do a collagen plug. Now, a collagen plug test, this test is something you can discuss with your patient, and you can tell them ahead of time before the day of doing this test that you're going to be doing a procedure on their eyes as a test, and you want them to take notes at home. How did they do over the last 7 days? And did they notice an improvement in how their eyes felt? Were they less red? Were they more comfortable? Were they less tired? You can ask them questions just like that. Were their contact lenses more comfortable? That's another big one that we see in our office. A lot of patients, especially in dry arid environments that wear contacts, are going to have an underlying dry eye that make their contact lenses uncomfortable. In fact, dry eyes is one of the leading causes that put patients in a situation where they discontinue use of contact lenses. So using Punctal plugs to improve their tear volume is going to make them more successful when wearing contact lenses. So in this scenario, this patient, you get their inflammation down in their eyes, and now you want to go ahead and do this collagen plug test. In this particular test, you would insert a collagen plug of the appropriate size into both the upper and lower tear ducts. And you want to make sure that you get those all the way down in and instruct your patient not to rub their eyes. As far as insurance reimbursement goes, you can also listen to our webinar on insurance aspects and billing. But when you put this type of plug in, there's a 10-day global period. And you can let your patient know that the plug is going to last anywhere from 7 to 10 days. And you want to know how they're doing during that time period. And if they were successful, let that patient know prior to putting these collagen plugs in that you're going to put in more permanent solution, which is going to help them long term to not have so many problems with dry eyes and not have to use eye drops constantly all the time. So that's the first one we would do. And the nice thing with the collagen plug test is the collagen plugs are going to go all the way into the tear ducts. And so if there is any chemosis in the conjunctiva, there's not going to be the top of a plug rubbing against that conjunctiva and causing any irritation or inflammation additionally. So that's step one. So let's say you go through the collagen plug test, everything's successful with your patient, they had an improvement in their symptoms, and now they've returned to your office for a more permanent solution. Well, in a patient where, particularly in our office, we have a lot of patients that are experiencing allergies. So if we look at that patient and we see, although they've been on anti-inflammatory therapy, which could be, like we said, your steroid, an immunomodulator, mast cell stabilizer, etc., but there's still some chemosis and still some inflammation, especially in the nasal portion of the conjunctiva. Well, in these patients, through our experience, we know that if you put a permanent silicone plug in place in that area and it's continually rubbing against that swollen conjunctiva, it could actually induce more inflammation. It could be uncomfortable for the patient, and that's what we're trying to avoid. So in these situations, we now have some newer products, and Lacrivera has all of these products. And they work really, really well. We use them in our office. And one of them is the Vera 90. And this particular plug is an absorbable 90-day plug. So you can tell your patient, listen, we may want to do a more permanent solution down the line, but currently you still have some inflammation in your eye. And so we want to put in a plug that's going to last about 90 days. And that's going to increase your tear volume during that time period. And we're going to be seeing you regularly during that time to make sure you're doing better. And especially around that, after 90 days, we're going to see what your symptoms are. And so you can put this 90-day plug in, and a lot of times what we'll do is we'll just do 2 plugs first. We'll do both lower lids, and we'll see how much that increases their tear volume with that one. If that's enough, great. But if they feel they're still having some dryness, then we'll also bring them back another 2 weeks later after the initial plugs were put in, and we'll put plugs in the upper ducts as well. And it's very important that you document that in your chart with the date so that when those plugs dissolve, if their symptoms come back, you know why that occurred. So that works really, really well. Additionally, for patients that are having a lot of allergies long-term and kind of have them seasonally throughout the year, they also offer a 180-day plug. And so this is more of a, like we said, a 6-month plug that's going to stay in place. And it can offer similar results, but it's going to last a little longer for your patients. And this can work really well too if you have patients that are going to be traveling. I have patients in Las Vegas that they may be in Vegas for a certain time period, and then they're in Florida for 3 months. And this is a good solution. So while they're in Vegas for the 3-month period, we may put in a temporary absorbable plug for 90 days. And then when they go to Florida, it's dissolved and they're fine there. Whereas with a permanent plug, they would probably be a little bit too wet in some scenarios within their eyes while they're in Florida. That's a couple of ways that you could use that are really successful for patients that have inflammation or have allergies. Also, we like to use these plugs in patients that post LASIK surgery or post PRK surgery, and also in patients that have had injuries to their eyes where their epithelium may need extra healing or their cornea needs extra attention. I always tell my patients that your cornea is going to heal more slowly when it's stressed. And a stressed cornea becomes stressed because it either has inflammation or it's under stress from dry eyes. So the cornea gets all its nutrition and liquid and hydration from the tear film. So if the tear film's lacking, you're putting stress on those cells and they're not going to recover as rapidly. So in these patients, this is another good scenario where you can put in a temporary plug, either a 90 or 180-day plug to assist your patients during that healing process. Okay, next we're going to move on to a more permanent plug. And the plug that we're going to be talking about next is the Flex Fit by Lacrivera. And this is a really nice plug because it's easy to insert for your patients and it stays in place because as it goes in, you can enter it into a smaller sized puncta, and then it's going to expand once it gets in. So these are great plugs for patients where they are losing plugs and they need a permanent solution to stay in. So it has a hollow nose within the plug. I like silicone plugs the best. So in patients where we've already addressed their tear film issues as far as tear film quality, but they're still lacking the amount of tear film that they have, I highly recommend a permanent plug. These are going to block the most tears from going down the lacrimal system into the nose, and it's going to provide the greatest volume of tears on the eyes. So usually in this scenario, we'll also treat it similar to the 90-day and 180-day plugs, in that we're going to put one plug in each eye to start. So we would do probably the lower ducts first, see how the patient does. And when we have that patient come back after that 10-day global period, we want to find out how often were their eyes watering, how often were they dry, how are they feeling if they wear contact lenses, and are they getting any symptoms. Based on that and the objective tests that we do in our office, we decide if they need to have another set of punctal plugs, permanent punctal plugs, and those would go in the upper ducts at that point. If we felt the patient was still dry and they needed more hydration on their eyes and in a larger tear volume, we would place these in the upper ducts, letting the patients know that there's a chance that they may have an increase in their eye watering at that point. And we like to insert these, especially if we're still seeing some SPK, some superior punctate keratitis on the corneas, despite having plugs and other treatments on their eyes. If that's the case, we're going to try to maximize their tear film by increasing their volume even more by putting the superior punctal plugs in. So the patients would then have 2 permanent plugs in each eye. With that scenario, in some cases, you're going to have patients where it may not happen right away, but as their tear film regenerates and it gets better and better, some of the cells on the eye, like the goblet cells, are going to start increasing their tear production and their secretions. And as that happens, their tear volume may increase to a point where their eyes are starting to water all the time. At that point, the permanent plugs aren't the best solution because patients become to get irritated with the constant watering, their vision starts to get blurry again. And in this scenario, you want to take out one of those permanent plugs, and you could replace it with a flow control plug. The flow control silicone plugs are a very nice invention, and the VeriPlug Flow by Lacrivera works excellent, and it comes in various sizes. You want to size it to the puncta appropriately. But in these patients where you're getting too much watering with 2 full permanent silicone plugs that are occluding the ducts, you can go to this flow control plug. And the flow control plug is going to let a certain percentage of the tears through, but it's still going to keep a large amount of tears from leaving that puncta. So in most scenarios in our office, we'll have one complete permanent silicone plug on one duct in let's say the inferior duct, and on the superior duct we may put a flow control silicone plug, and that tends to work really, really well for our patients. And then if it runs into a scenario where they're still having watering, I mean, you could replace that other permanent silicone plug with this flow control plug as well on the bottom if needed, but it's pretty rare that you would need to do that. So in summary, the silicone plug option is probably your best option for your patients that have a chronic dry eye condition, where you want a permanent solution. And the nice thing you can tell your patients is we do in our office is we can remove these at any time. And that always gives them the reassurance that this is a procedure that is reversible if it needs to be. And it's really important to explain to your patients in detail what you're doing, why you're doing it, and so they can understand the benefit to them. So it's a benefit to your office on the reimbursement side, and it's also going to help a lot of your patients, and so it's a practice builder as well for you. So in summary, with the silicone plugs, you have the 2 options we use most commonly in our office, which is the permanent silicone plug with the hollow nose, and that's called the FlexFit plug. We like this one the best because it can fit a wide range of sizes of puncta, but it also has a very good retention rate, and patients don't tend to feel this plug much at all, if ever. The next option, if that's blocking too much tears, is you can go to your flow control plug, which is going to block less percentage of tears from going out that puncta. So it's going to increase the tear volume some, but not as much as a solid permanent silicone plug. So to review everything we've covered in this webinar, the first thing I want to go back to again is that before you start treating with punctal plugs, it's important that you reduce the amount of inflammation in the eye first. If you're doing punctal occlusion on patients and they have a lot of inflammation in their eye that's not related to an injury or surgery or something like that, all you're doing is blocking the inflammation on the eye, which could potentially cause more damage to the cornea. So you want to bring down that inflammation first, and then you want to start to address your tear volume on the eye. And so that's the scenario and the paradigm that we use in our office. When you're doing that, as you're bringing that inflammation down, if the chemosis is still present to some degree, you're better off using some of these plugs that are 90 to 180 days because they're going all the way below the punctal surface, and you're not going to get any irritation on that conjunctiva. This is going to cause any additional inflammation on the eye, but it is going to increase your tear volume and it's going to give patients more comfort. And then you can reinsert those plugs again after 90 days or after 180 days as needed. As I mentioned at the start of this, the insurance payers, whether it's Medicare or private insurance, they view all plugs the same. So it's always going to be the same CPT code, which is 68761. When you feel like it's time to use a silicone plug in order to really increase the tear volume and provide the patients with a more permanent solution, you can use the silicone plug that is a solid flex fit plug. It does have a hollow nose as well, so it's very easy to insert. This is going to block a large percentage of the tears from leaving the eye, if not all of them. If you block both the upper and lower ducts, then the only way they're going to be losing tears is through the evaporative process in the environment. We also have the option now of the VeriPlug Flow, which is a flow control plug, which is going to let some of the tears out through the puncta, but still give you a large percentage of extra tears on the eye. And so with all these solutions now, this is really expands your treatment options for treating the dry eye conditions in your office and helping combat the ocular surface disease that so many patients present to in our office, but they don't need to live with. You can fix this for them. You can make their contact lenses feel more comfortable. You can make their everyday activities more enjoyable and their work more efficient. And so we thank you for attending this webinar today on behalf of Lacrivera. Thank you.